Hey guys, Dr. Greg from Judice Sports and Rehab, back again answering some answering some questions about the shoulder today. We got two questions today. The first one is very clinical and kind of specific and kind of a tough question because it's from a colleague of mine in Oklahoma. So we'll see if we can at least cover some new ideas. Kind of an interesting question though, for sure. But yeah, just two questions today. The first one is, if you have a patient that's got a long thoracic nerve injury and EMG studies show that the nerve is dead, what would you suggest to do? Because the physician is suggesting a tendon transfer for the pectoral muscles to stabilize the shoulder blade. So let's kind of dig into what the long thoracic nerve does. It supplies part of the muscles that stabilize the shoulder blade, specifically with weight-bearing activities, so putting weight through your hands or with lifting your arms overhead. And so if that nerve is injured, the muscles are not going to work like they're supposed to work. And so think of the nerves as a garden hose and the muscles as a plant. So if you cut off the supply to the garden hose, the muscles aren't getting any water, and eventually they're going to die and not be able to work like they're supposed to. So that's an unfortunate situation, and I hope it's not that's not the case, and hopefully that person would be able to get a second opinion that tells them otherwise. But if that is the case and that long thoracic nerve is dead, there has to be some sort of stability through the shoulder blade, because that is a extremely important muscle that would be supplied by the long thoracic nerve. I have never heard of a pectoral tendon transfer to replace the serratus anterior muscle, but I would definitely be interested in hearing more about that person. So thank you, Danielle, for the question, but we definitely need to chat in private because that sounds like an extremely interesting case, and I hope it's not who I am thinking about. So the second question is a question that I get very frequently. This is not necessarily from a particular person, but very often some people come into the office with shoulder pain. Because that is my specialty, that is most of the people that I see are folks with shoulder pain. And they come in and assume that, one, they've either got arthritis or a rotator cuff problem. And so we're going to kind of dig into a little bit about what the difference in arthritis and rotator cuff issues are, and whether people actually have arthritis or rotator cuff issues. So in general, around the shoulder, a lot of the issues become kind of a chicken or the egg type of situation, because typically one injury in the shoulder eventually leads to some of the other injuries in the shoulder. For example, a labral injury. So the labrum is basically a ring of something similar to cartilage inside of the socket of the joint that kind of keeps a suction on the ball part of the joint. And it stabilizes the shoulder joint. So if the labrum is injured, and say it's the first injured, if the labrum is the first thing injured, the joint is now unstable. And unstable doesn't mean it's dislocating, but it basically means it's not as firm and not as predictable as it should be for certain movements. So when a joint becomes unstable, what happens is the muscles around the joint need to become stronger to stabilize that and kind of make up the difference for the labrum being compromised. So if the muscles aren't working as hard as they should, the excess movement that occurs in the shoulder can actually put stress and strain on those tendons, causing a tendinopathy or a tendinitis, and eventually leading to potentially a rotator cuff tear, because rotator cuff is basically the nickname for 4 different muscles that make up the stability, the inside part stability of the shoulder. And so those can become stressed and strained as instability happens. Now, if we've got tendon pain and we've got excess mobility, what can happen from there is we can have excess stress on the joint itself, which over time, which over years, can lead to kind of a wearing thin of the cartilage, which can lead to arthritis, or in a short-term predicament, you could have what's called bursitis, which is the protective sac on the outside of the shoulder can get inflamed because of that lack of muscle activation and excess mobility through the shoulder. And so what typically happens is when you've got pain, you will eventually not move your shoulder as much, so that excess mobility becomes a limited mobility, because if it hurts, you're not going to use it as much. So now that limited mobility is a symptom sometimes of either rotator cuff issues or arthritis. And so again, it's kind of a chicken or the egg thing. Which came first, the arthritis or the rotator cuff? The rotator cuff or the labrum or the bursa, or any combination there. So it's really hard to self-diagnose, and that's why we highly recommend that you seek out a professional physical therapist who will take a great look at your shoulder and see exactly what's going on. We have some great special tests to figure out exactly what's going on, but really, if your shoulder doesn't move well, we can help your shoulder move well. If your shoulder's not strong enough to stabilize the motion that you do have, we can help show you the proper exercises for the strengthening aspect there. So, you know, there's a wide variety of issues that can go on through the shoulder, and because of that, like I keep saying, that chicken or the egg principle, it's a very complicated joint, and that's why I like it so much, because it's always a challenge to figure out exactly what's going on there. And because it's my passion, that's what I spent the most time with, I feel really confident that I can help you and your shoulder issues. So if you know anybody, especially in the St. Louis area, of course, suffering with some sort of shoulder issue, not able to lift overhead or pick anything up off the floor with weight, reaching behind their back, scratching the top of their head. If you know anybody like that, I would love to do what we call a complimentary discovery visit, which is a 20 to 30 minute evaluation where we discuss what's bothering them, do some measurements, strength, range of motion tests. We talk about what their goals would be. So typically that's going to be, I want to be able to pick my kid up off the floor, or I want to be able to throw a ball, or I want to be able to put my belt on without pain. And then we help make a plan. And that plan usually would involve us recommending physical therapy, but in certain cases, people don't need us, and we'll make sure that we let you know that. So, you know, I want everybody to leave that discovery visit with a plan for how to help themselves and how to help their shoulders and get back to the lives that they want to live without medications or surgery. So I think that wraps up today's video. We will be back next Friday. That'll be, is that the last Friday of the month? I believe it is. The last Friday in August. And so we'll have something fun, but still shoulder related for next week. So thanks guys for watching. Really appreciate it. And we'll be back next week.